everyone, and welcome into Pushing the Limits. Today, I have the wonderful Dr. Melvin Nario to guest, and I'm super excited. Welcome to the show, Melvin.
Hi, Lisa. Thank you for having me. Always a pleasure. And I've met you in our webinars before, and I was amazed by your story. That was your mother, you. There's so many things that you have gone through and very resilient about it. So
Oh,
salutes to you and your mom.
thanks, Dr. Melvin. That's really kind, and it's thanks to wonderful people like yourself, and learning from people like you and Dr. Bill Clearfield, who's a hero who's been on the show before, and who I know that you work with, and it's people like that that have taught me along the way, that have been wonderful mentors, whether they knew it or not. So, and I'm really excited to share a little bit of your experience today because. Obviously, Dr. Bill speaks so highly of you, and you've got an incredible breadth of knowledge in the integrated medical world that really is quite fascinating. Can you just give us a little bit of a backstory, where you came from, what you did, and how you got here?
Oh yeah. So well, Lisa, of course, I actually grew up in the Philippines. I did all my medical studies over there and graduated over there as a medical doctor. That's why I currently hold a license there as well. So I'm dual license here in the States and also in the Philippines. And I went over here. So my pre-med was actually a nurse. I was a nurse. I was a nursing student, actual registered nurse, and actually I became a nurse practitioner also, and then decided to pursue again my training here. I did my training in University of North Dakota, and that was my internship really started in Bismarck, North Dakota. That's for family medicine, and that's when I kind of found out really where my path is, because there was one incident there that we had to do rounds on a patient, and it's a patient who has migraines. And all my core residents, they of course are attending, was asking, "What is your treatment for this person?" Everybody said calcium channel blockers, all the prescription medicines. I came to me like, oh, let's probably give her melatonin, or maybe some magnesium, or even just like teach her not to use her phone at night, right? And everybody's looking at me funny, thinking that where did he get all of these crap? And
Two
and
heads.
right, so I was telling them you probably should read about melatonin and magnesium, and maybe you'll get a thing or two about it. But
Yeah.
I guess that's one of the little sparks in my life that I knew that I think I'm going somewhere else, and where you guys are going,
Yeah.
right?
Oh.
So, but then after that, yes, now I ended up in Las Vegas doing primary care. And there, and Vegas, I don't know if you've been there,
Yep, I've
but
been there.
right? It's Sin
It's
City to the
crazy.
max, meaning a lot of vices, food's cheap, nightlife with your friends, a lot of, and the workplace that I was in was very stressful. We were seeing like 40 patients a day. And this is
Wow.
regular medicine, right? And it was, of course, we were playing doctor within each one of us, because my colleagues there are my doctors too. And it's time for our annual blood work. And of course, he kind of like sat with me and told me, let's go in a room, let's talk about this. Hey, let's just talk in the lunchroom, talk about my blood test. What are you talking about? No, it's a little serious. So it came to the point that he told me that your liver enzymes are pretty elevated. Your blood pressure, we took it, it's a little high. You now have fatty liver, and
Whoa.
of course, you're pre-diabetic. That became kind of like the turning point for me. Now I am actually sitting on the other side of that
Wow.
table. I
Mm.
was now the patient, and he said, "We need to start doing medicines. We need to give you these specific blood workups. We're going to see you in 3 to 4 months." It was just like a whirlwind of things to me that I can't believe it. I was
Wow.
avoiding this before, and now it's me.
Wow.
So the thing that I did was I called my aunt, who was actually one of my mentors, Dr. Ibarra, who is in Reno, Nevada, and I told her my situation, and she said, "Come over. There are things that are out there that you don't know about, that you will be surprised that it will actually reverse what you have, and these are
Uh-huh.
not your medicines." During that
Mhm.
day, it was a shutdown, packed my bags, split, and went to Reno, and I guess it was history. So now I don't have all these medical issues. I was 180 pounds in Vegas. Now I'm basically 140, lost all that weight. And I tell everybody, this is the best that I've felt even when I was in my 20s or 30s. And I couldn't explain to you guys why and how, but it's just a totally different feeling compared to when I was younger.
Wow, that is quite a story. And and this is the I thought you were still in your 30s by the way, so you must be doing pretty good.
Oh, thank you.
Um, that would be the point that normally people get put on polypharmacy. You know, when you get fatty liver disease, you're overweight, you got metabolic dysregulation, insulin resistance, pre-diabetes, diabetes, all of those sorts of things are coming your way. Then it's 1, 2, 3, 4. This is where the track leads. And when you went to Nevada, which is a state that has a lot more medical freedoms than your average state, I believe, in America, when you came across the integrated functional medicine world, for the, whatever you want to call it, what was the shift in the paradigm thinking? You know, like, I mean, obviously with your migraine patient, I'll tell you a quick story. I was in the hospital with mum. She was having a gastrointestinal bleeding and whatever. There was another, actually a cousin of mine in there who'd been in there for weeks, and she was extreme pain, cramping like no tomorrow, like really, really bad, and they could not work it out. Like, and I'm like, have you had any magnesium? You know. And melatonin, and have you had magnesium especially? And she said no, and I said, well, I came in and I bought her some magnesium. Within 2 days she was out of hospital. They've been working on her for 3 weeks, you know, like
Wow.
as basic as magnesium deficiency, right? And it's
Well, we
like,
probably went to the same
wow.
medical school. That's what we look.
That was a shocker, right? And it's like that wasn't, you know, that wasn't rocket science. That was just basic. But
Well, you probably made the surgeons lose some money there for their college funds for their kids. So sorry for them. You found out the real treatment.
I'm not very popular up there, I can tell you. And not just for that case, but you also did homeopathy. And homeopathy, I must admit, I don't have a lot of knowledge on. Even though I lived in Austria, you know, where it's big. Um, but I've been getting a bit more fascinated by homeopathy. Can you give us an explanation of what homeopathy is and how you integrate it into your practice? And has it actually got anything? This is just my connection of the dots. Is it anything similar to peptide therapy in a way? Because it's a
Yeah,
small
that's true.
dose of
Good question.
creating, telling the body to make its own thing. Yeah, give me a bit of background on homeopathy.
Yeah, so Lisa, homeopathy is actually, so I actually am certified in homeopathy, and I'm actually currently the vice president of the homeopathic board here in Nevada. The thing with homeopathy is really it's classified as an energy type of medicine in the sense that you have what we call tinctures, and you dilute these tinctures, which are basically coming from herbs, minerals, and so many different animal extracts even into this in the smallest possible dilution that you can get, to the point that when you actually analyze these tinctures, you can't even find the molecule
Wow.
of physical molecule of the item that you put in there, because now what's left is in the energetic presence of that molecule is what's left. And this is where the rule of the smallest dose given to a body will actually respond better versus the allopathic model of giving higher doses to actually treat an illness. And this is where the problem lies. I'm not saying always with allopathic models, is because when you give higher doses, of course, higher side effects. In homeopathy, the smaller dose you give, the smallest stimulus to the body would be enough for it to heal on its own, and actually not the medicine that will do the magic, but it's really more of the smallest molecule will stimulate your immune system, your endocrinology system, the neurological, even the reproductive, all of these things. It's just like you flick your finger and let that echo, let that resonate throughout the body. You don't have to punch somebody so that you can actually make them feel the pain and the effect of that. So this is gentle, harmonic in terms of therapy, and it does not only address the physical issues like allopathy is. It's really affecting also emotional,
Mm.
spiritual, and even psychological.